Okay, students, welcome to Osseous System Part 4. In this system, we're going to be looking at the lower extremities. Okay, so what we're looking at here, we're going to start with the pelvic girdle. You can see it here. We have these two, wow, too much of a close-up. We have these two large bones. And we're going to look at them. Let's give them just a second to kind of come up to speed here. Sometimes it takes them a minute to kind of get up to where they're supposed to be. Okay, well, we're going to start out by looking at the pelvic girdle. And in the pelvic girdle, one of the things that we're going to see is we're going to see the ilium here. All right, as we look at this, here's the pelvic girdle. You can see this part, there's one large bone here and an identical one on the other side. We've already discussed the sacrum, as you see here. When we talk about these large bones, these large pelvic bones, there are two separate pelvic bones. They're really called coxal bones or os coxa or innominate. They really have three different names, coxal bone, os coxa, or innominate. But each one of those coxal bones, for example, is made of three separate bones. Okay? So it's actually made of three separate bones. All right. So when we're looking at this, we can see here we have one entire coxal bone. Here's another one, but it's really made of three separate bones. This most superior bone is called the ilium. And then we look posteriorly, here's the ischium. And then we have this bone, the pubic bone. We have all three of those unite to form one coxal or innominate bone. So let's start by looking at a couple things here. We're going to take away this membrane. We see a large hole here between these bones. So that's obviously a foramen. This is the obturator foramen. And if we look at the ilium, remember what's blue is ilium. We see this piece right here, this bump. This is the anterior superior iliac spine. So we'll see it here. Here's the anterior superior iliac spine. If we have that, we're also going to have an anterior inferior iliac spine. And if we have anteriors, we're also going to have posteriors, a posterior superior iliac spine and a posterior inferior iliac spine. And here we see the greater sciatic notch. Part of the acetabulum is formed here as well. Each of the three bones of the coxal bone will contribute to that acetabulum. So if we spin this around, beautiful ASIS here, AIIS, or anterior inferior iliac spine. Then we see the posterior superior and posterior inferior iliac spines. Here's that greater sciatic notch. Okay? We've seen the obturator foramen here. And something else we should look at, one of the parts of the ischium, and we can highlight this real quick. This is ischium, if you remember. So if we look at it, here you can see its contributions to the acetabulum. This large area is the ischial tuberosity. That's what you should be seated on now. And there is an ischial spine right there. So we can get rid of him. And then we can look at the pubic bone with its superior and inferior ramus. So here is the superior ramus. and then the inferior ramus. Okay, so in between them anteriorly, there's the pubic symphysis. Obviously, it's made of fibrocartilage. Okay, so that gives us the pelvic region. We do have a joint here between the sacrum and the ilium. Between these two, that would be the sacroiliac joint. So that would make sense. The joint between the sacrum and the ilium would be the sacroiliac joint. Now, guys, there are times when you look at this L5 vertebra, there are times when the L5 vertebra is actually fused to the sacrum. So they'll call that sacralization of L5. That does happen. And there are other times that um, the sacrum's first segment actually is not fully united with the sacrum, and they actually call that lumbarization. So most of the time, people have the same number of vertebrae, but sometimes they're just not fused to where you would expect them to be fused to. Okay? All right, so now let's take a minute and look at this bone. This is the femur, very large leg bone. Okay, so when we look at this, you can see on its proximal end it has a head, it has a neck, and then it is going to have greater and lesser trochanters. Greater trochanter, lesser trochanter. Now if we make this a little bit bigger and bring it down where we can look at it, this is a posterior view, and you know that because of the very long linea aspera. That's a ridge on the posterior aspect of the diaphysis of the femur. Anteriorly, you can see there is an intertrochanteric ridge. Posteriorly, very large intertrochanteric crest. Very, very large between the two. One thing to look at, on the head of the femur, there's a depression that's actually known as the fovea capitis. And that fovea capitis is very important because there is a ligament, the ligamentum teres. Teres means round, that attaches to the head of that femur. And you would think that that would be for stability. Well, this hip joint, we'll talk about it in just a minute, is a very stable joint, but not very mobile. Okay? Not very mobile by comparison to the shoulder. Okay? But what we do know is that that ligamentum teres actually has an artery in it, and that artery feeds the head of the femur. If injured, if that becomes injured, it can cut off blood supply, causing an ischemic necrosis, and that femoral head can be remodeled and damaged, and ultimately this would require surgical intervention and many times a complete hip prosthesis or an artificial hip. A very famous athlete had that happen, a man by the name of Bo Jackson. He played pro football and baseball at the same time, and he actually had a hip injury and ended up being ischemic necrosis and required a hip replacement. Okay, here you see the distal end of the femur. This is its anterior view. We're going to move this up a little bit. This is the anterior, and it does have a medial and lateral femoral condyle. And right there we see the patellar surface for the patella, the large sesamoid bone. And just like the elbow, when we turn around to the posterior, there's a depression here. This is known as the intercondylar fossa. And we're going to have areas around the femur. We're going to have the medial epicondyle with a little adductor tubercle and a lateral epicondyle. Okay, so that's the femur. Now you can see the patella right here. See if we can make it a little bit easier to see the patella for you. Yeah, there we go. There's the patella. Okay. What we want to do is go back to the hip and look at a couple of the ligaments here real quick if we can. When we look at the hip, we see there are uh, ligaments such as this, the iliofemoral ligament. Gonna hide those. There is a bursa there, the iliopectineal bursa. Let's get rid of that. And then let's look around. And now you can get a better appreciation for the way the femoral head fits into the acetabulum. All right, let's move down now and take a look at the lower leg with the tibia and also with the fibula. So as we move down, we're going to see a couple things. Yes, there are some bursa around the knee. Here we see the famous, here's the patella itself. It's a sesamoid bone. Although it's retropatellar surface, the posterior aspect of the patella has the thickest hyaline cartilage of any place in the body. Behind that, behind on the posterior patellar surface. Okay. All right. All right. Well, since we've seen that, let's go back to where we were, what we were looking at. Let's get rid of a couple of these bursa. We don't need these now. All right. So when we look at this, let's take a look first at the tibia. There's the tibia. It's the medial leg bone. When you look at it, here's its proximal end. Obviously, it's going to have lateral and medial condyles, and in between them is known as the intercondylar eminence. So I'm going to bring this down. This is sitting in anatomic position. If you're looking at the knee, the intercondylar eminence has attachments, elevations for the attachments of the cruciate ligaments. The cruciate ligaments. They're named cruciate because they actually cross within the joint, within the knee joint. Okay? That's how they're named. You might have heard of an ACL and PCL, anterior and posterior cruciate ligament, and the attachment named for their attachment to the tibia. So how they're attached to the tibia, anterior, posterior, really gives them that name. Here you see the famous tibial tuberosity. This is really an epiphyseal, there's a growth plate here. Very famous condition that occurs in this region is Osgood-Schlatter disease. You might have heard of this, very, very common. Also remember that the patellar ligament inserts there for the patella. And if we move distally on this, we can get down to the distal end and we see a very large medial malleolus sticking over the medial aspect of the ankle. So that's where we are. Lateral to that is this bone. This is the fibula. The fibula itself doesn't bear any weight in the human. So the fibula really doesn't bear any weight. This particular bone, it does have a head. So if we look at it this way, we can see there's a fibular head. And there's also going to be a neck distal to that. And then it doesn't have a medial malleolus. What the fibula has is a lateral malleolus. And then we want to look at itself. We'll see if we can go back and look at the knee a little bit, identify those cruciate ligaments. Very, very neat to see. So we're going to make this a little bit bigger for you guys. May have to move it around just a little bit. I apologize for that. Here you can see a posterior view of the knee. And yes, we have a number of these bursa. We're going to hide those so you can appreciate the knee here. Right here you can see the posterior cruciate ligament. See, it's posterior. And then there you see the anterior cruciate ligament. Notice how it's attached to the front, and notice how those ligaments actually cross within the knee. Yes, we also have, I'm going to get rid of this retropatellar bursa or infrapatellar bursa. This is the pes anserinus bursa, very nice. You see that near or adjacent to the medial collateral ligament of the knee, and there's also a lateral collateral ligament. All right. Here you see the cruciate ligaments, anterior and posterior. Okay. Well, now what we're going to do is we're going to look at really the foot. So I'm going to move this up. Now we don't have, obviously we don't have carpal bones here. We're going to have tarsal bones. We don't have the same number. I'm going to see if I can get rid of a few things here. We're going to get rid of just a few things so we can really appreciate the way the foot looks. Lots and lots of ligaments around the ankle. I mean, just a ton. So we want to get rid of those so those aren't in our way when we go to view things. And the retinacula, we want to get that out of the way. All right, so when we look at the foot, we're going to see that we actually have metatarsals. And we have one, the calcaneus. You see it there. I'm going to make this a little bit smaller for you. Okay, there's the calcaneus, the heel bone. And then if you look, we also have a talus that articulates with the calcaneus. Then we're going to have some other bones in the foot, and this is probably the best way to view them. I'm going to check something, see if we have another view of feet. I think this is going to be our best one. All right. So let's go down and look at the foot itself. So we have tarsal bones here. We have a calcaneus. Then above that, the talus, which articulates with the tibia. Then we're going to have three cuneiforms, medial, intermediate, and lateral, a cuboid, and a navicular. Okay, so those are the bones we're going to have. Then we have 5 metatarsals, obviously named to begin. Number 1 is the first metatarsal. And then just like the hand, we have phalanges. We have 3 phalanges in digits 2 through 5, and 2 phalanges in digit number 1, or the hallux. So again, if we remove some of the material that we're seeing here, there's our talus. See if we can flip this guy up just a little bit. We'll get a better view on that foot. There we go. Not the view I wanted. Okay, here we go. So let's get rid of these guys. Now we're in good shape. Okay. Move this up just a little bit here. All right. All right, when we look at this, here you see there's the calcaneus. We've seen that. There's a talus that's near that. Here are a 1, 2, 3, 4, and 5 metatarsals. That's easy to see. And if we make this a little bigger, we'll look right in on the top of the foot. We can see the actual bones here. We do have some ligaments we'll get rid of. But we can see there are three cuneiforms. Let's get rid of these guys. There we go. And these guys right here. Get rid of them. All right, so here is the medial cuneiform, the intermediate cuneiform, the lateral cuneiform. At the base of the fifth metatarsal is the cuboid, and back here would be the navicular. Then, as we said, 1 through 5 metatarsals, and then as we saw in the hand, phalanges. And the phalanges are very simple. Remember, in digit 1, we just have a proximal and distal phalanx. In digits 2 through 5, we have proximal, middle, and distal. Now, the only other thing that's different is these joints would not be metacarpophalangeal. They would be metatarsophalangeal joints. And then we have the proximal interphalangeal joints and distal interphalangeal joints of digits 2 through 5. And then we have just the interphalangeal joint of this digit, of the first digit. Okay? Okay, guys. Well, I hope this has been helpful to you. That's really all we have to talk about for the skeletal system. Okay? All right, guys. Have a great night. Have a great day. If you have any questions, please let me know. Take care.